Today's the day we kick off the season of gathering for large meals. The holidays also unfortunately trigger a lot of cases of heartburn. KOMO's Denise Whitaker joins us live to show us the dangers that can come with heartburn and expert advice to avoid it. Denise?
Right. More than 15 million Americans actually depend on over-the-counter heartburn medications every day to help control their issues. But those medications can come with some serious side effects. I talked with Dr. Mark Ratner about this to get more information. He tells me those pills are called proton pump inhibitor drugs, or PPIs. He says they're not intended to be used long-term. You may know them by their brand names like Prilosec or Nexium. They stop your stomach from producing acid. When the FDA approved them 15 years ago, Dr. Ratner tells me the approval was for a 14-day period. But PPIs work so well that people have become very dependent on them. This type of chronic use, he tells me, however, can cause some rather serious side effects.
Anybody who's had chronic heartburn and then starts taking one of these PPIs will tell you it's amazing. It's like flipping a switch, but they shouldn't be used chronically without some cautions. The two big factors that we worry about are vitamin B12 and magnesium, both of which do require stomach acid to be present for optimal absorption.
Taking supplements to counter those side effects can help, but Dr. Ratner tells me there is also research that suggests chronic use of these acid blockers can lead to many other side effects. For instance, a loss in bone density, increased risk of dementia, plus an increased risk for heart disease and kidney disease. So as we head into these season of indulgences and big eating, Dr. Ratner cautions people to kind of take it easy, definitely avoid the foods that they know may give them heartburn, certainly try not to overeat, and anyone who has a chronic use of these pills, he says, really should probably consult their doctors.
And Denise, is it easy to stop taking the PPIs after you start?
Dr. Ratner says it is not easy to stop, and that's because your stomach is used to not having that acid there with that switch that he talked about. He says what it can do is, he said it just can cause weeks of misery. He says that he went through it himself. It's absolutely horrible. Diarrhea, chest pain, other issues, all caused from just suddenly stopping those medications. So definitely, he says it's such an issue that he even wrote an ebook trying to help other people with this situation. I made that easy for you to find. Just go to KOMOnews.com/hotlinks.